Assalamu alaikum. In today's class, we'll be discussing about implementation phase, or you can say the intervention phase of the nursing process. This will be at the step 4, then the fourth step of the nursing process. So let us discuss it in detail. Nursing intervention is actually a nursing action. Here a nurse actually does the procedure whatever she has planned. So the action, it may be any treatment which she provides to the patient, any diagnostic or therapeutic procedure which she does on the patient, or any other nursing activity which is required for the patient's recovery. Nursing performing an action to achieve outcome for medical or nursing intervention only for those for which she is accountable. So nursing intervention are the actual implementation of the care plan. This means that here whatever she has planned in the previous steps, she actually now start doing the same. For example, if she has planned that I have to go for cold sponging, then she does the cold sponging. If she has planned that we have to go for the suctioning of the patient, but here actually she performs the procedure of suctioning on the same patient. So that is why it is called as nursing action. So implementation is the action phase of the nursing process, and implementation it is meant to carry out or to perform or to intervene or to do something. So implementation is to carry out, to perform, to intervene or to do something for a patient. Nursing activities may be carried out either by one nurse or it may be delegated to group of nurses depending upon the patient's needs. So now let us see what actually is the definition of the nursing intervention. So nursing intervention is defined as any action taken by the nurse to help the client move from a present health state to the health state which is described in an expected outcome. For example, if the patient's present health state is that patient is having a fever of 101 degrees Fahrenheit, the expected outcome is to maintain the normal body temperature. So to achieve that goal, whatever a nurse actually does for a patient, that all will come under the nursing intervention. Let us see the requirements of implementation. So for implementing any step or any action on a patient, a nurse should have the basic four skills, or we can say the four requirements. The first of all is she should have knowledge, she should have a technical skill, she should have communication skills, and she should be able to use herself therapeutically. So knowledge it includes all those intellectual skills such as problem solving, decision making and teaching. In knowledge, she has the knowledge regarding a particular procedure, she has the knowledge regarding a particular disease, she has a knowledge regarding a particular patient's condition that how it can be managed. And the technical skill means to carry out the treatment and procedure. For example, to overcome the patient's problem, what all technical skill need? Sometimes to overcome the dehydration, she may have to put on the IV line for which she has to put on the cannula first. So that will come under the technical skills. Now the communication skill, use of verbal and non-verbal communication to carry out planned nursing intervention. Here she explains procedure to the patient to his or her level of understanding, and also she collects the articles, she communicates with other staff members, she communicates the findings of the patient, she reports the patient's condition. So accordingly she should have the communication skill to carry out the implementation phase. Then the therapeutic use of self, it is being able willing or able to being to care for the patient. So once a nurse feeling that she is being willing and being able to care, that means she is using herself therapeutically. So these are the four requirements for implementation. Let us now discuss about the purpose of implementation. So implementation has various purposes. The main purpose of implementation is to provide therapeutic nursing care to the patient. So another will be to help client to achieve optimal level of health. So it is used to provide technical and therapeutic nursing care, to assess the client or to reassess the client, to perform the nursing action, and to finally document whatever we have performed. Characteristics of nursing intervention. So intervention should always be congruent with the overall plan of care. That means whatever you have planned in the planning phase, you have to perform the same kind of interventions in the intervention phase. And all your interventions, whatever you have planned and whatever you are doing, those should be based on scientific principles and they should have a rationale. And this intervention should be individualized to the client. For example, if you have a two patient with the same kind of problem, it's not necessary that both of them require same kind of intervention. They may require different intervention for the same problem. That is what we call as individualized. And these interventions should be designed to provide safe and therapeutic environment to the patient. It should be able to consider the patient's needs for teaching and learning. And during intervention, a nurse should be able to use resources appropriately, and everything like a patient and the staff members, they should be clearly communicating regarding what you have done, how you have done, and what are the outcomes. Skills required for a nurse in implementation. So here we have the basic four skills which are required for a nurse in the implementation phase. Those are cognitive skills, interpersonal skills, technical skills, and psychomotor skills. Cognitive skill means implementation or application, or it involves the application of the knowledge to anticipate and identify clients' needs. Cognitive skill means you apply your knowledge, you apply whatever you have learned to the patient so that you will be able to know about the patient's needs. It includes problem solving, decision making, and teaching. Another skill which is required for a nurse to perform the intervention is interpersonal skill. Interpersonal skill is actually the ability to work with others to achieve a goal. So this means how you are using your communication skills to actually communicate your whatever you want to do with the patient, whatever you want to do procedure on the patient, how you will communicate it to the patient and how you will communicate it to your teamwork. So here a nurse uses communication skill to carry out planned nursing intervention. And for this, a nurse must have knowledge and skill of developing and maintaining interpersonal and intrapersonal relationships. The third skill required is psychomotor skill. It will require the integration of cognitive and motor activities. For example, for giving intramuscular injection, a nurse need to have the knowledge of anatomy and physiology of the body, as well as the knowledge how to prepare, how to load, and how to administer the injection. So she uses the theoretical knowledge, she uses the practical skills, and she then actually performs the procedure of intramuscular injection. That is what we call as psychomotor skills. And such skills are important while dressing up the wounds, while giving injections, while performing suctioning, or while performing the tracheostomy care for a patient. The fourth skill which is required is technical skill. It is the skill which is needed to use equipments. So technical means how you can use the equipments required for a patient care, machines or supplies in a particular specialty. For example, how to operate a ventilator, how to use a suction apparatus, or you can say the physiotherapy machine, suctioning machine, and infusion pump. This is what a technical skill means. Classification of nursing interventions. They have been classified into various categories like family nursing intervention, behavioral nursing intervention, and basic physiological nursing intervention, and many others. So let's first discuss these three. So family intervention, as its name indicates, this means yeah, here a nurse, whatever an intervention is applied, is not applicable to the patient only, but to other family members of the patient as well. For example, if a patient is having influenza or any respiratory problem, so nurse educates the other family members regarding the use of masks and distancing and other things, cough etiquettes. And sometimes if one patient is having some communicable disease, so intervention will be applicable to other family members as well. So that is what we call as family nursing intervention. Then behavioral intervention. In this category, it includes those actions which will help a patient to change unhealthy behavior or habit. So here a nurse actually uses the intervention or action to help a patient to change his unhealthy behavior. For example, if a patient is using smoking, so in that case, a nurse can provide such interventions where a patient can overcome his withdrawal symptoms and may overcome smoking. Same with the use of drugs. Or a nurse will educate a patient regarding exercises. In that case, a patient may be able to maintain his weight and be healthy. Then basic physiological nursing intervention. These include those interventions which are concerning to the patient's physical health, including such as hands-on procedures, for example, feeding to hygienic assistance. Basic physiology means meeting the basic needs of the patient like food, shelter, need for hygiene and other things. So all those interventions or procedures which a nurse does to feed a patient to maintain his hygiene, those all will come under basic physiological nursing interventions. Other types of nursing interventions include complex physiological interventions and community nursing intervention. Complex physiological intervention include those physiological interventions which are more complex than those basic physiological, such as doing any procedure for a patient like insertion of an IV line to administer fluids to dehydrated patients. And community nursing interventions are those which are organized efforts that encourage general health and wellness of not only the patients or clients or their families, including their community as well. For example, if a patient is there who is having the COVID-19, but he is not only the person who will receive the vaccination, the family as well as the community may also need vaccination or may also need to take precautions. Other type of interventions include safety nursing intervention and health system interventions. Safety nursing intervention means those where a particular nurse she does such procedures or she does such kind of interventions which will help a patient to prevent from any kind of injury. For example, if a patient has undergone surgery, so at that particular time, the main aim of a nurse is to educate the patient on those procedures where a patient will protect himself from injury. For example, injury of that surgical site, infection of that surgical site, or straining over those sutures. And because these safety interventions may include instruction for using a walker or cane or how to take a shower safely. Or you can say if your patient is a post-operative patient, in that particular case, a nurse may use side rails to prevent a patient from injury, like from preventing the patient from fall. So all those kind of intervention where patient safety is to be considered, those are called safety nursing interventions. Then the health system intervention, these are those intervention while actually a nurse performs those routine procedures which will help a patient to ensure safe environment and also comfortable environment. Such as for example, you have a patient who is there for a bed on a bed for prolonged period of time. In that particular case, your main aim is to provide the safe environment for the patient by providing air water mattresses or by turning the patient to one side or another side frequently so that the bed sore will be prevented, or avoiding slippery floors, or educating the patient regarding the type of floor or use of slippers to prevent falls. So these interventions which will help to make a patient's environment safe and comfortable, those are called health system interventions. One of the important points which will you come across during your intervention phase is rationale. Whenever you are planning any kind of intervention or you are doing any intervention on a patient, you should have a rationale, or you can say the scientific background. For example, you should know, you are doing the suctioning, you should know why you are doing suctioning on this particular patient, why it is important. So you should know the background. Same thing, you are doing some other procedure, or you are doing some other intervention, you should know the rationale or the scientific background behind that particular action. And rationale is a must, most importantly for the students, because it will help them to learn, to be accountable, to be to know that why we are doing this particular kind of intervention, why it's important, and why should we do it, or is it necessary or not. This was all about the intervention. So in this video we discussed about the fourth step of the nursing process, which is intervention. Why it is important, what is its purpose, what are the various skills which are required by a nurse to perform this intervention, and what is the classification, and what do you mean by rationale. And if you found this video helpful, do like, share and subscribe to my channel. Thank you.